Imagine two children, both 5 years old, starting school on the same day. One comes from a middle-class suburban neighborhood where education is prioritized and after-school activities are the norm. The other lives in an urban area where financial struggles are part of daily life and access to books, nutritious food, and even a safe place to play is limited. How do their environments shape their psychological development? Child psychology is deeply intertwined with culture and socioeconomic status, shaping how children perceive themselves, interact with others, and respond to stress. The World Health Organization reports that children from lower socioeconomic backgrounds are at a 3 times higher risk of developing mental health disorders compared to their wealthier peers. This is not just about money, it's about access to healthcare, education, emotionally supportive environments, and opportunities for growth. Let's take a closer look at culture. Every culture has its own beliefs about child rearing, discipline, emotional expression, and mental health. In some collectivist cultures, like those in many parts of Asia, Africa, and Latin America, children are taught to prioritize family and community over individual desires. This can foster a strong sense of belonging, but may also discourage open discussions about personal struggles, particularly mental health concerns. In contrast, individualistic cultures, such as those in the US and many European countries, emphasize self-expression, independence, and personal achievement. Research has found that children in collectivist cultures tend to have lower rates of externalizing disorders, like ADHD, but may experience higher levels of internalized stress due to pressure to conform. One fascinating study compared emotional regulation in children from China and the United States. The results showed that Chinese children were more likely to suppress negative emotions, while American children were encouraged to verbalize their feelings. But what's really interesting is how this affects mental health outcomes. Suppression of emotions has been linked to higher rates of anxiety and depression, but excessive emotional expression without regulation can lead to difficulty managing stress and impulsivity. This highlights the importance of balance and cultural sensitivity when working with children. Then, there's the powerful role of socioeconomic factors. The Adverse Childhood Experiences Study, conducted by the CDC and Kaiser Permanente, found that children who experience poverty, neglect, exposure to violence, or parental mental illness are far more likely to struggle with cognitive delays, behavioral issues, and long-term emotional difficulties. One of the biggest stressors for children in lower-income families is chronic stress, living in an unpredictable environment where food insecurity, housing instability, and financial worries dominate daily life. Chronic stress has been shown to increase cortisol levels, which over time can impair memory, emotional regulation, and even immune function. Consider the case of Jeannie, the feral child, one of the most famous cases in psychology. She was raised in extreme isolation and neglect, without exposure to language or normal human interactions. When she was discovered at age 13, her brain had already passed the critical period for language development, making it nearly impossible for her to acquire normal speech. This tragic case demonstrates how environmental deprivation can profoundly impact cognitive and social development. While most children will not experience such extreme neglect, many face less visible but equally harmful forms of deprivation, such as lack of access to quality education, parental guidance, or emotional support. Interestingly, studies show that resilience can overcome socioeconomic disadvantages. Research from Harvard's Center on the Developing Child found that children who have at least one stable, supportive relationship, whether it's with a parent, teacher, or mentor, are significantly more likely to succeed, even in difficult circumstances. Programs like Head Start in the US, which provide early childhood education to low-income families, have been linked to higher graduation rates, lower incarceration rates, and better mental health outcomes later in life. Culture and class do not just influence how children develop, they also shape how we, as psychologists, educators, and caregivers, approach mental health treatment. A one-size-fits-all approach simply does not work. Therapy that focuses on individual achievement might resonate with a child from a Western background, but for a child from a collectivist culture, interventions that involve the family and emphasize group well-being may be far more effective. Similarly, when working with children from lower-income backgrounds, acknowledging the stress of financial instability and offering realistic, accessible coping strategies can make a huge difference. At its core, understanding cultural and socioeconomic influences in child psychology is about empathy and adaptability. Children do not grow up in a vacuum. Their development is shaped by their world, their families, and their communities. When we take these factors into account, we do not just treat symptoms, We help children thrive in their own unique environments, with the support and understanding they deserve.